And this morning's San Jose shooting is just one of the many examples of gun violence in the U.S. this year. It comes on the heels of at least 12 mass shootings across the country this weekend, and more than 230 in total so far this year, according to the Gun Violence Archive. Dr. Sanam Hafiz is here with more on how to cope with this trauma from gun violence. Dr. Hafiz, thank you for being here. You know, so often we're warned about becoming numb to gun violence because we hear about it so often. But how are Americans supposed to cope when this keeps on happening?
I mean, it's a very sad state of affairs. You know, Americans are so weary after this pandemic that we've all been through. There is so much anxiety related to the re-entry after this pandemic. And yet we are here again with mass shooting after mass shooting, this contagion that, you know, one big shooting is on the, comes on the heels of another big shooting. And so the ones, of us who are anxious about going back into the world might say to themselves, it's safer back at home. So there is a lot of chronic, consistent trauma associated with this. And on the flip side, the sort of helplessness, the apathy that comes with resigning yourself to the state of affairs.
And Dr. Hafiz, one of the concomitant experiences people have, one of the associated experiences is anxiety. Not just the people in that area, but everybody. Schools don't seem to be safe. Workplaces don't seem to be safe. Public events. I covered the Manchester bombing in England a few years back, and there was a sense that people weren't going to go to concerts anymore. Of course, they did. But for people who are stressed out, understandably, about this plague in this country, how do we deal with that anxiety in our daily lives?
I think the focus on mental health has to be very widespread. From dealing with just the fallout of the pandemic to the chronic exposure of feeling that you're not safe anywhere. I mean, there was a shooting at a grocery store in Boulder, Colorado. Then very shortly after, there was a FedEx shooting. And now there's this. And I probably honestly can't keep up. So I'm probably missing a few of them. So there is a sense of fearfulness, especially when this happens. And then as human beings, a couple of days pass and we sort of acclimate and kind of go back to our lives. So the access to mental health services has got to be a much bigger focus of this administration, of the nonprofits out there, psychologists, psychiatrists, mental health professionals like myself are available on telehealth a lot more than they ever were before the pandemic. So if you feel that your anxiety is at an all-time high from not just coping with the stressors that are facing us, but from mass shootings like this, if you feel that your anxiety is where you are really afraid to go back into the real world and you're missing out on life, it's time to seek help. But, even for the general public to be able to access a hotline, a toll-free number, a support group, I think it would be very helpful. And it would sort of give us sort of like a renewed faith and hope in the mental health services across the country, because clearly there is a connection here. When we talked about how triggers are often the leading cause of someone, engaging in these mass shootings, it's because they didn't know how to access that help. And that's a really stark reality we all will have to face. I mean, people like myself in the mental health field for sure, but I think this is really obvious for everyone to see.
And Dr. Hafiz, there are family members and friends of victims from this morning's shooting in San Jose that are just learning that they lost a loved one today. What can you do to support those people who are grappling with this immediate impact?
Crisis intervention is a huge part of any kind of traumatic event. Professionals, psychologists, psychiatrists, social workers, counselors who can help you absorb the shock, because that's really what you're dealing with. You're dealing with shock. The grief isn't going to set in until much later. Then there's going to be denial and anger, and there's so many emotions. And then providing care for the spouses and especially the young children that might have been left behind by this tragedy.
All right, Dr. Sanam Hafiz, thanks to have you. We appreciate your time today.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.